Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. With me today is Dr. Bryn Henderson, and we are going to take a deep look into the condition called atherosclerosis. I can tell you it's one of the leading causes of heart attacks, strokes, poor blood flow in the legs. And a lot of times after they do an autopsy, the family will get it back, and on the death certificate, it will say atherosclerosis as the cause of death. And they go, what's that? Nobody ever told us our mother had that or our father had that. So we're going to talk about it today, and we're going to learn what it is, how not to get it, and if you have it, how to at least reverse it the best way you can. So, doctor, what is it?
Well, we've helped many patients live a lot longer by identifying their cause. So let's start. The problem is in part fats, cholesterol, and other substances that slowly build up on the inner walls of our arteries. These buildups or plaque narrow the blood vessel's ability to carry blood. Over time, this can lead to serious problems like heart attacks, stroke, and of course, leg circulation issues. What makes it tricky is that this process can happen silently over many years. People often do not know they have it until they experience something major.
Okay, so like I said, on the death certificate, it will say atherosclerosis, and the children are going, the doctor didn't tell us mom had that. What's going on?
Exactly. That's why we sometimes call it a silent disease. It often doesn't cause symptoms early on, but inside the body, the damage is building. And by the time symptoms show up, like chest pain or trouble walking or arteries, might already be badly narrowed or blocked.
All right, so let's narrow it down to the main things that cause this to happen.
Okay, the high cholesterol is a big one. High blood pressure is close number 2, but you got these other bad boys that play in this. The smoking, the diabetes, the being overweight, and a big one, the lack of physical activity. These are all building on top of a genetics that play a role with some people by simply being born. It's based on a family history. Even stress can add to this mix. It's a perfect storm of lifestyle and biology.
All right, so we read these studies, or at least I do, where during the Vietnam War, and I wasn't even a doctor then, I was in my 20s. And I remembered that they were doing autopsies, and they said they already have atherosclerosis and they're only in their 20s. That's when they started saying something's wrong with what we're eating, because we never saw this before.
Yeah, and that surprises a lot of people. We found that fatty streaks, the earliest signs of atherosclerosis, can form in the arteries of children as well as teens, and is often linked to poor diet, high cholesterol in early life. And if a mother has high cholesterol during her pregnancy, the baby's arteries can already start showing changes before birth. So it's never too early to think about heart health.
All right, so let's talk about treatment. What can we do to stop it, or at least reverse it, if nothing else? I mean, I'm not saying you can clean up a lifetime of damage, but certainly we can clean up the arteries, right?
Well, for sure. The first step is to address your lifestyle. Eat diets that are rich in fruits, vegetables, and if you're going to do fats, eat healthy fats.
Nuts, avocados.
Yeah. And of course, exercising regularly and not smoking help a lot. And then one of the big impacts is stress.
How could stress, though, cause your arteries to have plaque? I just don't get that. I mean, I understand stress with anxiety or depression or something in your psychologically, but how could your physical body start plaquing out inside your arteries and your veins from just being stressed?
Well, you're correct in that many of us eat when we're stressed.
Oh, I see. Okay.
But the other side of this is the medical reactions that are different when you're stressed. You look at here, the stress hormones, cortisol and adrenaline, can lead to increased blood pressure, worse inflammation, and higher cholesterol, all of which damage the blood vessels and promote plaque. The stress can negatively impact lipids, increase oxidation stress, and affect blood clotting, further accelerating the progression of atherosclerosis.
Okay, so before we get to the newer treatment, what have we been doing the last 30 years that worked?
Right. Well, I think one of the things we've learned is a major impact that lifestyle has been. There's no question that is a major benefit. If we're getting enough sleep, decreasing our stress, having adequate fluids and hydration. And of course, the other thing that we have to do is a more balanced, comprehensive approach to our diet. So over the past 30 years, the treatment has evolved from a primary focus on risk factor to a more comprehensive approach that includes lifestyles, medications, surgical or procedural interventions.
Okay, so what's your favorite medicine that you like to use?
I don't know if I have a single favorite. The cardiac world would start with statins. The widespread use of statins, I am sure those are billion-dollar drugs. They lower low-density lipids and refine procedures by making it a lot less necessary. In other words, the angioplasties and stent placements decrease when the statins are given.
Okay, so the first line of defense, shall we say, that most physicians would do is let's start you off on a statin because I don't want you to get to a point where you have to have surgical interventions.
I agree with that. I think there's wisdom in starting low and going slow.
So what about a patient coming in and they say, I don't want to do a statin, just give me one of your famous IVs, doc. What can you do to clean out their arteries?
Depending upon the cause, chelation and other things work very well to decrease the plaque. There's two types of plaque. One's hard, it's been bound to the inside walls of the vessels, and the second is soft.
All right, let's talk about chelation. In the 80s, it was very hush-hush. In the 80s and 90s, I knew doctors that were doing it, but you had to be really careful because it wasn't standard of care. Mm-hmm. And if you don't do standard of care, that's a no-no. So how did chelation therapy now become acceptable in the sight of the Medical Board of California?
It's been accepted because of two reasons, one of which is they found metals in our water supplies and other things, and we have that buildup just like the plastic in what we eat. But the bigger impact is that the chelation therapy worked. And so now they had a bunch of data saying, if we do this, we take this from a 50% occlusion down to 30 or down to 25.
We're in good shape.
Yes.
Okay. Now, I'm going to ask a question that has nothing to do with atherosclerosis, but you brought it up because I know it's something that bothers me, and I'm sure it bothers people. Is there anything we can do to pull the plastics out of our body that we're eating and drinking? I've seen studies where they say how much is in our food. They've even said how many nano drops of plastic we were eating. So I'm saying, do any of your stem cells or your exosomes or your peptides, will they pull out plastic?
There's multiple facets of regenerative medicine that help. Why? Regenerative medicine is really predicated upon how we can mimic the body because of its innate ability to help repair itself. We damage it and they can help fix it. Even acupuncture, yes, acupuncture showing potential in improving blood flow. And you start improving blood flow, then you start decreasing the hard plaque and eventually the soft plaque building up on terms of the vessels.
Most of the patients want to know, what is plaque? How does it even start forming? What I say, and you can agree with me or not, or correct me if I'm wrong, I always tell them this. Have you ever been hiking up in the mountains and you're up there and there's a little stream and it's a nice little bubbly clear stream in the mountains, and all of a sudden you get to a point where there's some leaves that have dropped and then they kind of get sticky and they stick together and then it almost becomes like a dam, and then the water kind of goes around the sticky leaves. That's how I try to describe it. Is that a good?
Sure, absolutely.
Yeah.
It alters the blood flow.
Uh-huh.
And it changes the turbulence, which decreases the body's ability to clean it. So there's no question.
Okay, so now let's talk about a chelation patient.
We have a lot of them. We had a 57-year-old man come in with high blood pressure, leg discomfort, test showed early atherosclerosis in his arteries. That was done by an ultrasound, and we put him on the 15-session course of chelation. And by the end, the scan showed that one of his arteries, originally narrowed at age 25, had cleared up to almost nothing.
Oh, wow.
And he had less cramping and better movement. Most of the time, we don't catch it quite that early. They're in the 35s or 50% occlusion. So while not a cure-all, they still have a dramatic improvement in the volume of blood that is now able to get upstairs to their brain or down to their feet.
And they didn't have to do surgery and have all sorts of the invasive.
That is the beauty of it. Non-invasive therapies in this case.
All right, so let's just review atherosclerosis, and we've got a mnemonic that says clean your arteries. So the C
Is cholesterol control.
L
Is the lifestyle changes.
E
Eat heart healthy.
A
Avoid tobacco.
N
Normalize blood pressure.
A
A1C control.
R
Reduce stress.
T
Is take medications properly.
S.
Stay in touch with your doctor.
Hope our audience takes it to heart and starts being proactive with their health. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.